Good afternoon, and welcome to the CDP webinar, Puerto Rico, Finding Opportunity in Crisis. This is Regine Webster, generous support of this webinar series. Joe Ruiz, Director of Humanitarian Programs with UPS, was not able to join today's webinar, but I know that he sends his thanks to all participants on the line today. This week, CDP's Assistant Director of Grants and Disasters, Anna R, and I have been in Puerto Rico to meet with funders and non-governmental organizations working to help the island recover. We're also joined today by Miriam Gelo, Voluntary Agency Liaison with FEMA's Individual Assistance Division, who will outline the federal response to date and some of the work that they've seen unfold here. A couple of reminders before we get started. First, this webinar is being recorded. Second, there's a little box at the bottom of your screen where you can submit a question. So if you have any questions at any time, use that Q&A chat box at the bottom of the screen. And if you're on Twitter, please use hashtag CDP for recovery to share the discussion. We'll now turn first to Miriam to cover how things have unfolded in the federal sector. Miriam's worked with the Federal Emergency Management Agency, FEMA, since 2001 and is currently based out of FEMA headquarters in Washington, D.C. A native New Yorker, she began her career in emergency management as a volunteer during the September 2001 attack at the World Trade Center. During that event, she was hired on by FEMA and has since responded to numerous disaster activations across the country and the Caribbean. She works within FEMA Individual Assistance Division as a Voluntary Agency Liaison, or what we call VALS, and provides FEMA programmatic information to voluntary organizations that are active in disaster, as well as private sector, local, state, tribal, territorial, and other federal agencies and operations. Miriam has been working in Puerto Rico in response to Hurricanes Irma and Maria. Over to you, Miriam.
Thank you, Regine. And thank you all for being on the call today. So I have been in Puerto Rico for the past 5 months since 4 days after landfall. A lot has transpired on the federal side, as well as the Commonwealth side and the local side. Regarding the FEMA activities, we are currently working 2 disaster declarations. Hurricane Irma, which was declared on September 10th, and Hurricane Maria, which was federally declared September 20th. If you see on your presentation the registration numbers for each disaster, which we are currently working both disasters simultaneously and really focusing more so on Maria. The third bolded bullet there is the FEMA Individuals and Households Program. The totals that have been approved for individuals and households is a combined number for both declarations, and anything following this presentation will be combined numbers. But if you take a look there, the amount approved and the amount dispersed, which is actually the money that disaster survivors have in their hand, is over $1 million. And we've had disaster case management is also something that we've got active here. We've got immediate disaster case management program. There's 101 case managers, and that includes the continental United States. There are 31 case managers here on the island. The rest are working with disaster survivors that have evacuated Puerto Rico to go to stay in either transitional sheltering assistance hotels on the mainland or stay with friends and family. These are people that have self-evacuated. Just to give you a number back to the IHP, there's been over 1 million people, 1,108,371 people that have registered for federal assistance. And again, that's a combined number, and that's actually on the 3rd slide. But so if we go to the next slide. The transitional sheltering assistance, these are the folks that have evacuated to the United States. And you'll see there in Puerto Rico, which is at actually it's kind of cut off there, but on the numbers, on the top there, you see that there's 891 households or families that are staying in hotels here on the island, and then Florida, Massachusetts, New York, Pennsylvania, Connecticut, follow suit with the most people that are staying in hotels. And this is not including the people that are staying with friends and family. Next slide. Okay, this just gives you a picture, the top, as to some of our stats of what has been done. So you'll see the commodities, water, the meals that have been distributed. So 16.99 million gallons of potable water. You know, I'm not going to read through each one, but over 62 million meals have been served. You'll see the individuals and households and the registration numbers that are up top there, what I just covered, and just some other statistics, including disaster unemployment and what the Army Corps of Engineers has been doing with the temporary roofing. The bottom numbers are is data provided by Puerto Rico government, their power, their water, their power, and just some other information. So you see what the recovery status has been. Oh, I'm sorry, I said 1 million. It's 1 billion.
Yeah.
So, yeah, sorry, I'm being corrected here. It's $1 billion dispersed. I said 1 million. So that's a big chunk of change that's out there in the hands of disaster survivors. And again, going back to this slide, it's the status PR. If anybody's interested in looking at the status, you know, you can, there's type that up as a website, status PR, and it'll give you like daily statistics as to where they are in the recovery process or restoration process. Next slide, please. This just gives, you know, as far as what it is that we do, the FEMA Voluntary Agency Liaisons, we do normally on a day-to-day operation fall within the individual assistance division. We have recently, as of this week, restructured the organization for this operation. So if you look at the top, and those of you that are familiar with the National Disaster Recovery Framework, we'll see the Health and Social Services sector. So we've gone to a sector-based approach, which is closely aligns to the NDRF, the National Disaster Recovery Framework. And on speaking on behalf of my section, we do partner with the Puerto Rico VOAD. We've got the Corporation for National and Community Service mission assigned here, the AmeriCorps teams helping support debris removal and mucking and gutting homes, tree removal, minor home repairs. So they're working in collaboration with the voluntary agencies. The VAL team, this is what our organizational structure looks like. We do have some vacancies which we hire locally. I just left it intact. I didn't clean anything up. This is, you know, the raw data we're working with. But this is inside the joint field office. So this is pretty much the team that works here as liaisons to other federal agencies. We do have a donations warehouse that we are currently, as of this week, shutting down in Jacksonville, Florida. And that was not for all unsolicited donations. It was had a specific mission, but we even had operations in Kona supporting this, the Puerto Rico and U.S. Virgin Islands operation. So at the end, you'll see we have internal ops team, and then we've got the external ops. So if you go to the next slide. Next slide, please. There we go. So this is our external ops operations team. There are 4 branches, and on the very next slide, there's going to be pretty much what the island breakdown looks like, but these are the teams that we've got out there helping with the local community, helping develop long-term recovery groups, and with the municipality mayors and other local government officials. Next slide. So this is what the branch structure looks like on the island, how FEMA is currently, FEMA and the Commonwealth is currently working. So you'll see the branch 3 offices on the far eastern end of the island. It's got individual, divisions. Well, branch 1 is all the way to the east. It's got 2 divisions. Then we've got branch 2, which is the northern half of the island, and Branch 4, which is the southern half of the island, broken up by division. And then there's Vieques and Culebra, which is also part of Branch 3, further out east. But this is pretty much the breakdown of how we're structured. So if you hear branches or divisions, and where our VAL teams are, this is what that looks like. And then the next slide. We are working very closely with the national and Puerto Rico voluntary organizations active in disaster. There have been a lot of voluntary organizations, volunteer and faith-based organizations that have participated in the response and recovery efforts. There's over 120, and when I say over, I mean like well over. It could be closer to 140, 150, if not more. It's really hard to gauge everybody that we're coming in contact with, because this, culturally it's very religious based, so a lot of faith-based churches are participating in that local community development, those local community recovery efforts, and our FEMA VALs are out there engaging with them, trying to find where these coalitions or conversations are happening organically, and trying to set up long-term recovery groups based on what's already happening on the island, and then in conversation with Puerto Rico and the National BOAD to engage, bring in those national and Commonwealth level resources. This disaster has also had a very unique feel to it, because it is a United States territory with the federal resources. However, it's got that international feel to it, and a lot of international organizations that have come to assist as well have, they speak on the cluster system and just terminology that is not used to what we discussed, with VOAD. Our VOAD is like their equivalent of clusters. So it's been a learning curve for most of us that are not here from the island, but it's not a challenge that we haven't been able to meet. And then the long-term recovery groups, you heard me mention that there are currently 4 pretty established long-term recovery groups on the east side, so in Branch 3, but there are other groups that are meeting at the other in the other branches, and we're looking to formalize those structures a little bit firmer and get them to where they no longer need us. They can bring in their own resources, and just have these structures so that when our external partners come in, they're meeting with one group instead of a lot of different organizations. So that concludes what I have to share. Regine, thank you.
Thank you so much, Miriam. I super appreciate all of your comments, and we've already had a couple of questions come through in terms of being able to share your presentation, and also to learn more about job vacancies. The team over here has already answered some of those questions on the Q&A box. I'd encourage all of the rest of you on the phone right now to feel free to use that Q&A chat box. We'd be happy to answer your questions throughout the course of the discussion. I'd like to now introduce Anna Hurt, my colleague and travel partner. She's our Assistant Director of Disasters and Grants at the Center for Disaster Philanthropy, and I'll just turn the mic on over to her.
Good afternoon, everyone. Thanks for joining us today. It's been a really busy and long few days here in Puerto Rico, but like a lot of other things in life, once you begin to see the challenges and wrap your head and heart around them, they change you, and you can't go back to knowing things as you knew them before. I think that's a sentiment I've heard a lot during the past few days. Since Hurricane Miriam made landfall on September 20th, it both worsened existing problems in Puerto Rico and it unearthed new vulnerabilities. And I can tell you that in the past few days, I've seen how incredible the people here are and what they've been able to do for Puerto Rico and for each other in the last 5 months. During my time here, I've had the chance to meet with a number of organizations working to help move the process from relief to recovery, and I'd just like to spend a little bit of time talking about each of them. So one of the first places or organizations that I met with was Mercy Corps, and they've been in Puerto Rico since the early days following the storm, providing financial support and relief items and conducting recovery assessments. They're now working with local community centers, bringing their expertise and supplies to transform them into kind of resilient centers and hubs that provide solar energy and clean water, as well as disaster preparedness and risk reduction elements, and allow those centers to come back online quickly following a disaster or crisis and serve their communities through those events. In addition, Mercy Corps will be helping use the hubs to establish gardens and greenhouses that provide communities with fresh produce for consumption and sale. And the proceeds from that will go to support the sustainability of new infrastructure. They're also working with some small farmers in the area surrounding the hubs to support livelihoods and agricultural recovery. This project alone is expected to impact more than 90,000 individuals. They've also identified small business recovery as a critical gap area and are hoping to expand their recovery strategy to support tourism and other small businesses through really tailored support. It was great spending a few times. I had the opportunity to meet some staff that I've interacted with over quite a while. And so it was fun being able to be here with them in Puerto Rico and see what they're up to. Yesterday, I also spent some time walking through Banco de Alimentos of Puerto Rico. The food bank is the only one on the island, and it went from receiving 25,000 pounds of food a day to receiving and processing about 250,000 pounds of food a day in the same building and with the same staff. They typically distribute about 10 million pounds of food a year, but in the 5 months since Maria, they have distributed about 8.7 million pounds of food around the island. They are in the process of moving all of their equipment and stores and staff to a new building, and we spoke a lot about the additional needs that they have around new equipment for the building, new trucks that they're going to need, and some repairs that'll help make that property fully functional for them. I'm always blown away whenever I am visiting a food bank by what they're able to become in their community after a disaster, and it really didn't take that long for me to see that present and with the team there. My last meeting yesterday was around a program called Information is Aid that's funded with a partnership between NetHope and Internews. Program involves placing citizen journalists in their communities to write about what's happening in a way that both fosters discussion and interaction, but also galvanizes change and action in communities. It was really incredible to hear from the team here how those journalists are accomplishing what they set out to do. The goal is not only to continue the program and the dialogue in those communities, but expand it into a larger listening post program and use those programs to augment preparedness in communities and really have them ready and those information networks in place that are both kind of online networks and offline networks for future disasters. This morning, Regine and I were able to visit World Central Kitchen, which uses chefs to drive food creation and distribution in really challenging situations around the world. And we got to walk through and meet their team and listen to what they've been doing since Hurricane Maria. In Puerto Rico, World Central Kitchen at its peak of operations was creating and distributing about 120,000 meals a day, which is really amazing. Today, our last visit today, before we came here, was we visited the Access to Justice Foundation, where we learned a lot about the incredible legal issues existing right now in Puerto Rico's recovery. They're specifically working to address land title issues on many fronts, the legal needs of older adults and those with disabilities in the disaster, and they're looking for ways that they can combine the legal services with psychosocial support. They spent a lot of time working with their lawyers to submit and appeal FEMA applications on behalf of Puerto Ricans to help them get the federal aid they need. And then tomorrow, before I leave to come home, I'll be spending the morning with All Hearts and Hands out at one of their bases. I just want to mention, prior to my time here in Puerto Rico, I've spoken with many other members of the National VOAD who are working here on the island. And during my time here, I've learned a lot about local nonprofits who I'm hoping to spend the coming months getting to know better. I've heard a set of needs repeated a lot over the past few days, most notably reaching out to older adults and how vulnerable they are right now, meeting the needs of children, the mental health needs, continued food networks, especially the long-term agricultural and small business needs, and a lot of others. And I'm gonna stop there for a moment. While I've been meeting with the NGOs, Regine has been meeting with local philanthropic leadership, so I'm gonna turn it over to her and she can talk about how that has unfolded.
Thanks, Anna. I'll echo, I think what you're going to hear here, let me just back up 1 second and say, as I mentioned, Anna and I have been traveling together for the past few days, but by day we separate and take our own meetings, and then over breakfast or over dinner, we debrief on our days. And so it's been interesting to see what themes have cropped up across the meeting with the NGO community that Anna has taken, and then with the funder community that I've taken. So hopefully you'll see kind of the two sides of the coin to Anna and I's time here. So like many of you, we've been researching the needs in Puerto Rico since Irma and Maria made landfall on the island. Coming here, though, to see the need in person and speak with people on the ground has really been eye-opening. I want to start by saying this. For people to live without access to cash, access to gas, access to water, and access to light and electricity for months on end is incomprehensible. For those of us stateside, we just absolutely cannot even fathom what that's like to navigate daily life without these four things that we consider to be must-haves. And they were must-haves for Puerto Ricans the day before Maria hit. So while the government's reporting that the island is somewhere in the neighborhood of 80% back in terms of electricity, we know that there remain many municipalities that have an almost total lack of electricity to this day, 5 months out from the disaster. So my humble learning is that we cannot yet talk about the recovery period, in all caps, without talking about and continuing to attend to meeting these basic needs. So that said, there's a tremendous amount of hope and action here in Puerto Rico. Over the past few days, I've met with leaders from the Network of Funders of Puerto Rico, La Red de Fundaciones de Puerto Rico, FEMA or FEMA, Unidos por Puerto Rico, Foundation for Puerto Rico, the Miranda Foundation, the Community Foundation of Puerto Rico, and the Banco Popular Foundation. Tomorrow I'm meeting with Fondos Unidos, or the United Way, as well as Big Brothers and Big Sisters of Puerto Rico. So certainly, just like Anna, there's other organizations whom I was not able to meet with on this 5-day trip to San Juan, but I would argue that the CDP team will be back in Puerto Rico soon. During my conversations with the local funder community, the questions I posed most often were fourfold. Number one, what does your current hurricane-related funding portfolio look like? Number two, how are you working with other partners? Number three, what are the needs that continue to emerge or bubble up? And four, how would you want the Center for Disaster Philanthropy through its CDP Atlantic Hurricane Season Fund to jump in and help with the funds that we have available to grant out? I want to share with you a few observations or learnings that have come to my attention over the past few days. First of all, the benefits of space, physical and metaphysical, or no, physical and metaphorical, is that what I'm trying to say? Sorry. I was so impressed with the leadership of the Banco Popular Foundation, as well as the Foundation for Puerto Rico. They opened up their offices to nonprofit organizations, entrepreneurs, governmental bodies, and the community at large, giving them literal space to work, to have electricity and Wi-Fi, and figurative space to connect with others, decompress, and get to work. When I think about something that we really celebrate about private foundations and our ability to convene and serve as a convener, I cannot impress more how these two foundations, the Banco Popular Foundation as well as the Foundation for Puerto Rico, really embodied that belief. And we just have two really powerful examples right now of organizations who really made that connection happen. Number two learning for me, or thinking for me, is the need to think about meeting those basic current needs as well as thinking about systems change. I'm really impressed with the ability of many of these funders to conceptualize meeting the daily need of communities for potable water or energy, while at the same time building programs that address long-term water needs and/or that would mitigate against future power outages. The issue areas that I heard most funders speak about, both as needs as well, current needs, as well as areas that they're funding, include water, efforts to increase electrical resiliency, economic development, small business development, which is arguably a portion of economic development, food security, housing, education, and health. Additional concerns that have arisen include rising unemployment due to business closures and changes in school registration giving children moving off island or to other parts of the island. As a result, we know that local NGOs are really having to increase their client base considerably. And in truth, none of what I just listed really have short-term solutions, but rather they'll require that special balance I spoke about a moment ago between meeting current needs and thinking more long-term and perhaps boldly about what future state looks like. At the same time, I heard several funders use this kind of language. We need to move fast. We cannot just sit. And I know I've said this before, but each funder is definitely striving towards a balanced approach to their grant making and their programmatic work. Several funders have expressed both a need and an interest in investing in more robust data collection systems, in thinking that perhaps those systems could aggregate demographic data against service provision in municipalities, or that perhaps they could even work across the island to get a broad picture of all needs and all solutions. My next observation I don't actually say very lightly, given that I'm sitting in the FEMA Joint Field Operations Center surrounded by six FEMA professionals. So it's tricky to say what I'm about to say, but you know, the private funder community has expressed confusion around FEMA's long-term role and how philanthropy can, could, and should connect with FEMA. Anna and I and several FEMA professionals and several other philanthropic professionals are hoping to make some introductions over the course of the next couple of weeks. But there's confusion, and I think it's worthy to acknowledge that. And before I close out my remarks, I'll just say, I just end on a hopeful note. Anna and I have encountered a tremendous loyalty and dedication to Puerto Rico's future. One of the leaders that we met this week said, "There is no future in rebuilding our past." The expertise, courage, get it done attitude demonstrated by the philanthropic community here is impressive. So that's what I've learned over the course of my few days here. Now we get a chance to turn over to you and hear your questions and answers. I'm going to play both moderator a little bit as well as question answer, and I have Anna and Miriam sitting in front of me. Some of the questions actually came into us when people registered. So I'm going to go ahead and pose the ones that came in through our online portal first. But I would love it if everybody would take a look at that Q&A box at the bottom of your screen and plan on asking some of the questions that we pose. The first question I'm going to pose came to us from Hector Mujica from google.org. What are the biggest needs of small businesses and entrepreneurs now? Anna or Miriam, do you want to answer that?
Hi, this is Miriam. I don't have the Small Business Administration statistics here for the loan application, but the biggest need, obviously, across the island, and I know that there's been some confusion, you know, what Regine said towards the end with, you know, the federal FEMA role in recovery, but I just want to make it clear that this is not a typical disaster response. There's many, many, many portions of the island that are still in sustained response mode. So that the lack of power the lack of power continues to be a number one issue. FEMA is trying to get out of the commodities distribution business because that is affecting local economy, and we want to encourage the local economy. I know that a couple of weeks ago there was a bit of a scare that we were pulling out completely, and that's not the case. You know, there is still a need, and it has to be strategic distribution efforts that occur, and not, you know, we're no longer that knee-jerk response phase, if you will, but we can assess and coordinate and communicate better with the local municipalities as to where the continued needs are due to that lack of power, due to lack of commodities or items being able to be purchased in the stores. You go to the east side of the island, which was the hardest, well, I don't want to say the hardest impact, but it's where the hurricane came in. you know, it's more populated, more resources, and you've got the mountainous areas in the center part of the island that are, as the rains continue, even, you know, this weekend or, you know, daily, roads are still washing out, which prohibits access to certain areas. So it's really hard to state where all the business needs are because the island is in different phases of response/recovery.
Anna, this question is coming to you from Patrick Turnwald from the RUSA Fund of Block Island Ecumenical Ministries. I'm particularly interested in identifying organizations that are successful at getting help out of Puerto Rico cities and into the countryside, and including Vieques and Culebra, both immediate needs and longer-term recovery building. Do you have anything to say about organizations that are serving those areas?
Sure. Most of the NGOs I was able to meet with over the past few days are all working in the countryside in outlying areas that most of which still don't have power and basic necessities. All the ones that I just listed certainly have outreach into those areas, and a lot of the local ones also have ongoing programming into the island. So they all, I think they all, you know, they reach out, and I think to a large extent, mostly are focused on areas outside of San Juan.
Anna, one more question for you. What's the capacity of a large outside organization like a Habitat for Humanity to make significant progress in rebuilding homes?
Yeah, I actually had the chance to talk to the program manager for Habitat Hammers Back, which is the initiative that Habitat for Humanity is using to address the needs in all three hurricanes to hit the U.S. At the end of 2017. And so certainly the affiliate here in Puerto Rico was small to begin with, and small in terms of capacity to begin with, but their resolve to work through the housing issues and provide, you know, that kind of recovery support to families here in Puerto Rico is there, and they'll be working on that for years to come.
I'll pose this question to both Miriam and Anna, and maybe Miriam, you could start. Can you talk a little bit about the housing situation and a plan for short and long-term recovery housing?
Sure. So I mentioned in my presentation, we have the Transitional Sheltering Assistance Program activated. This disaster, FEMA has pretty much toggled every single program that we have available to support the response and recovery efforts for the island. More on it, there is an initiative here that we are piloting. We're building the pilot as, you know, building the plane as we're flying. And it's called VALOR, which is the Voluntary Agency Leading and Organizing Repair. And basically, it's not a FEMA program. We are controlling it a little bit because it is being piloted. However, the intent for that program is for FEMA to purchase building materials to give to voluntary agencies who are conducting minor home repair. And doing mucking and gutting and making the home safe, sanitary, and functional, at least for them to shelter in place, while the individuals and household program and the other federal funds come down the pike, and they can do more permanent or major repairs to their home. So that's something that is being initiated here. It's been done different ways in other disasters, but it's really taking shape on this one. There's the Commonwealth Program, which is called Tu Hogar Renace, for anybody that's familiar with the STEP program, which is the Sheltering and Temporary Central Power Program. That was something that was, again, piloted in New York, New Jersey after Hurricane Sandy. But it is something that is being administered by the Commonwealth, and that is pretty much, no pun intended, a step above VALOR. Where it includes restoration of power and water, again on a temporary basis. Then through our, those are both public assistance programs, so they don't compete or duplicate any efforts with the 408 programs, which are the individual and household programs, which includes permanent housing construction, the repair, multifamily repair, and direct lease. So we've got a couple of programs as well that are for the disaster survivors. We're working very closely with Housing and Urban Development, with the local, with the Commonwealth Departamento de Vivienda, the housing department, and others, to work collaboratively and think of solutions, more permanent solutions, as well as mitigation, to make sure that people who are currently in high, washout areas due to mudslides or flooding, obviously we're on an island, so this is going to be a bit more challenging, but how to mitigate their homes and prepare for the next event. So we're thinking strategically, looking forward, how to repair and rebuild in collaboration with our other federal and voluntary organization partners in the best way possible.
I'll pose a question that's come through to myself, actually. And it's about addressing the philanthropic support for nonprofit advocacy efforts across the island. For instance, around specific policies, including funding for social services, debt forgiveness, repeal of the Jones Act, that directly affect the ability of Puerto Ricans to recover. I'll be honest and say I can't specifically speak to debt forgiveness or repeal of the Jones Act, but I would like to highlight two things. First of all, there's a program that's funded, well, I'll highlight three things. First of all, the Miranda Foundation is an organization to look at in terms of the work that they have been doing, both pre and post the disaster. Espacios Abiertos, so open spaces, is a program that's funded by Open Society that I'm also fairly certain has an advocacy component to it. And then the last one, and Anna spoke about this organization a little bit, it's the Foundation for the Access of Justice, so it's Fundación Fondo del Acceso de la Justicia, and I believe that they have advocacy elements to their work as well. So those three organizations would be ones that I would take a look at. Before we came onto the webinar, we were asked a specific question about the availability of women's health care and domestic violence services. And this was posed by our colleague over at the International Planned Parenthood Federation. And Anna, with the help of one of our colleagues here at FEMA, is going to answer that question. And it's something that certainly we could follow up on at a later date with more information if need be.
Sure. So there is an organization called Taller Salud working in Loiza that specifically addresses domestic violence and women's issues. And I would just add that when we were in our meeting with FEMA the other day, one of the needs that they mentioned was the need for maternal health support and women's health support around Puerto Rico. And the final thing I would note is just that every NGO that I know that's working on island and forming programming that's forming program in general around Puerto Rico takes into very careful account how many women they're serving and what the needs of the women are in areas that they're working. So while it may not be specific to the area of domestic violence, I do believe that all of them are working really hard to look at, that how the needs of women, which are very different, following a disaster, are being met. And then I'm just handed a note here about, so there has been some discussion in some of the local communities about the need, especially in the islands off of Puerto Rico, for doulas, because there aren't functioning medical clinics and women don't have access to have a birth attendant when they're throughout their pregnancy and then when they're giving birth.
Thanks, Anna. I'm going to over to Miriam now. How and when will the Valor program be announced? The one that seeks to purchase building materials to give to organizations, and then how are all those programs announced and shared with NGOs?
Sure. So currently, if there's an organization that's interested in participating in Valor, they can send an email to FEMA-Valor PR I'm sorry, FEMA-ValorPR@FEMA.DHS.gov. There is a vetting process, so there are some questions that will be asked. We run it by the Puerto Rico VOAD chair. There's some questions that we vet the organization in order for them to participate. So I hope that was the question. We're still working. As I said, we're building the plane as we're flying it. There's some messaging. There has been some messaging that's gone out, some fact sheets that have been distributed. But for right now, if anybody on the call is interested in participating or knows of an organization that's here on the island, or even from CONUS, that can help support this effort, please send an email to that email address.
Miriam, we got a cautionary note from one of our listeners about the time issue, and our participant on the phone says the time issue will be a big problem. This next Monday is the first public hearing on the CDBG DR money, and one of the requirements for all proposals is that money has to be spent in 2 years. This is something to have in mind. Do you want to comment on David's thinking about time and how it relates to the CDBG?
So regarding the grant funds and just the local community efforts, knowing that there's a time factor, we are working with, again, HUD and other partners that have a stake in anything that is housing related. So as you saw in the organizational chart, we fall within the health and social services sector, but there is a whole other sector that's the housing sector. And they do have CDBG DR as part of their organizational structure to work with that and get that up and running and engage everybody that has a stake in with that grant program.
That's super helpful. Thank you. We've got a question here about any leads on efforts for the ones that are in the United States, and that's a pretty important question. I will say that the Miami Foundation has certainly been providing funds to individuals from Puerto Rico who have come over to Florida. They also have a fund that they hold that is dedicated to funding directly in Florida. We know that there is, I don't know if large is the right word, but medium-sized Puerto Rican community that has gone to Cleveland, and our colleagues over at the Westfield Insurance Foundation are partnering with other local foundations to ensure that those individuals who have emigrated from Puerto Rico are well taken care of. So those are some of the efforts that we know. I believe that there's also FEMA assistance, considerable FEMA assistance in the States. No, Miriam?
There has been assistance to the population, the Puerto Rican population. Just because they're on CONUS doesn't mean that they're not eligible or are not receiving federal assistance, or they applied for FEMA assistance. And by the way, the registration date for any survivor that hasn't registered yet is March 20th. So that's kind of unprecedented. It's almost 6 months after the event. But they still have time to register if they haven't done so already. So that's eligible for them, as well as there are, again, I had mentioned that there are disaster case managers out in the continental U.S. working with disaster survivors as well. So disaster and employment. So all the federal programs that we've got, crisis counseling, they have access to those programs. And there are multi-agency resource centers. Well, there were 2 in Florida. Puerto Rico and Florida have a host state agreement, and a majority of the evacuees have kind of settled temporarily in Florida. And there is a host state agreement between the 2 states there. And there are multi-agency resource centers that can assist those disaster survivors, and some of the other states with a high population have not necessarily a mark set up, but other programs that assist those disaster survivors and help provide them with resources until they can get back home here.
We had another question come through here about people who were homeless prior to the disaster that have become homeless due to the disaster and don't have the financial means for post-disaster housing, as well as those who were housed in affordable housing prior to the disaster. I will be honest to the person who posed that question. I have not honestly heard anything about individuals who were homeless in advance of the disaster in any of the conversations that I've had thus far. But I will say that access to affordable housing and housing rebuild is one of the main issues that we've heard time and time again. And I think that that's going to take local government, federal government, private philanthropy, community groups. It's going to be an all hands on deck activity to make sure that housing needs are covered. I think that Miriam said this in her comment, but I'm just going to underscore it because it was something that was really powerful for me. The individual assistance registrations that FEMA received represent 100% of the island. And so that means that effectively 100% of individuals, families, and communities across this island were affected. Those with large houses, those with small houses, those with no homes are facing challenges, and certainly individuals who are homeless in anticipation of the storm are going to face some of the gravest challenges. So I know I'm not coming to you with data or specifics on that, but it's a general sense. Anna, we've gotten a question here about cultural institutions like La Casa del Libro Library or Museum that were severely impacted and have not been in the eye of many of the rescue and support efforts. Can you speak to what you know about any economic assistance or support to help those institutions?
Sure. So we know that those groups are identified in FEMA's Natural and Cultural Resources focus, and that there's an assessment underway to look at those needs. There's also an organization called SURF that works to support arts and cultural centers and artists in disasters. And the American Library Association is also helping look at those needs here in Puerto Rico.
Another individual just raised a question here about if there's any type of support or help for cancer patient needs, medicines, diagnostic tests, or procedures. I am just going to say straight up, I don't have an answer for that at all, but I'm looking across the table at Miriam or Anna to see if they have perhaps a solution about individuals who are undergoing treatment or are medically dependent.
Yes, this is Miriam. There have been the Department of Health here in Puerto Rico and Department of Health and Human Services, the federal agency, along with numerous voluntary organizations, both domestic and international, have been assisting patients with some of their healthcare needs, including those, dialysis. And so it's an ongoing process as the infrastructure. One of FEMA's first things that we did is provide generators and backup generators to the hospital facilities, those that weren't severely affected by impacted by the storm themselves, so that they can get power up and running to help provide some of those needs. The evacuation, some organizations assisted very lightly. I'm not going to with transportation, whether funds to get them to states to higher echelon of care. But there continue to be organizations working with pharmaceutical companies like Heart to Heart International and Project Hope and a few other organizations, AmeriCares, that have been in Samaritan's Purse, that have been in since the beginning, assisting these patients and helping work side by side with local and federal government officials, and getting the pharmaceuticals that are needed here, since the pharmacies were down.
I'll add one other piece here that's just a note has been passed to me. There is a voluntary foundation curing cancer, so it's Fundación Voluntarios Curando Cáncer. So that might be an organization to look into that could be of assistance. We also have been asked about grassroots community groups and informing the strategies by that are going to be used by governmental efforts. Again, I'm going to look across the table at both Anna and Miriam and see if they have any wisdom about grassroots efforts and the recovery effort here.
So I can go back to my conversation I had with Justin at Internews and that Hook yesterday and talk a little bit about their grassroots, if I can speak correctly today, efforts with citizen journalists in their communities. And, you know, when I was talking to Justin yesterday, he told me this really interesting story about how there was an older gentleman in a community that his roof was completely destroyed and he had stepped on a nail and he had diabetes. And so he was having like ongoing medical problems and he couldn't, you know, really do anything to his house. And one of their citizen journalists wrote a story about this gentleman and like what he was experiencing. And through that story, people in the community came and helped him. There was someone, a landscaper in the community that came and cut the tree down off of his roof, and they came and fixed his roof and provided him other help. And so, you know, I think things like that are really powerful when you start thinking about the networks that each community forms and how they come together. And so it was interesting to hear from Justin yesterday how that's worked out for their organization. And then also, you know, of course, I can't go and talk about this local effort without mentioning the Puerto Rican VOAD, which has been working and is continuing to work from day one until now in Puerto Rico, and their continued efforts with long-term recovery groups and their local nonprofits. And so we had a chance to meet the head of the Puerto Rico VOAD here at the Joint Operations Center the other day, and so it was our pleasure to meet him, and we look forward to working with him and also members of the National VOAD throughout the recovery process.
I'm going to go back one question from now. Janice Petrovich, who's actually the head of the network of Puerto Rican funders, she is offering some advice to us regarding the question of funding arts institutions, and she reminds us that the Hispanic Federation has been supporting a number of them throughout the island, and that many local funders have provided emergency support for museums and arts institutions such as Beta Local. There are a couple of other questions that are in our question log. I believe that the question that's been posed to us about dialysis patients, we would likely have the same answer to that question as we did, that Miriam answered earlier about medically dependent and patients or those undergoing treatment. And then we've just actually answered the grassroots question. So we have answered all of the questions that have been posed to us today, and we are actually nearing the top of the hour. So I'm going to head and go and wrap up our time today by offering some thanks. First of all, thank you so much to Miriam for taking your time to share your insights. And the millions of thanks to the individuals who are sitting around the table with us, also from the Voluntary Agency Liaison group, who've helped us answer some of these more difficult technical questions that we've been fielding today. And a very special thanks to the UPS Foundation for sponsoring this webinar. And 3 million thanks to all of you who have stayed on the line with us today. We are always welcome to hear from you. If there are questions or thoughts that you have that weren't addressed through this webinar, you are more than welcome to email me at regine.webster@disasterphilanthropy.org. I'd like to thank all of you and wish you all a wonderful afternoon. Thank you so much.